What is neuropsychology? Neuropsychology is a branch in psychology and neuroscience that aims to understand brain function and behavior related to specific psychological processes. Neuropsychology is a branch in psychology that aims to understand specific psychological processes from neuroscience perspective, whereby it is a scientific approach to investigate the relationship between brain and behavior. By using neuropsychological evaluation, it helps physicians to evaluate the extent of impairment or neurological condition that might affect or impact a person's ability, such as to remember, process information, and make a decision making. Neuropsychological evaluations may also be used to examine the ability of the person to return to work, school, or college after a brain injury, stroke, or other neurological illness. In summary, the central focus of neuropsychology is the development of science of human behavior based on the function of the human brain. Neuropsychology field is comprised of two main areas, which are clinical neuropsychology and cognitive neuropsychology. It should be noted that the overlap of these two main areas does exist, as one specialty area complements and adds to the knowledge of the other area. So for this part, I will briefly define or describe clinical neuropsychology and cognitive neuropsychology. What is clinical neuropsychology? Clinical neuropsychology is a subfield of psychology that applies the principles of brain behavior relationships. In this field, the assessment and intervention are based upon the evidence from the scientific study of human behavior. From the scientific studies, you can understand and link up normal and abnormal functioning of the central nervous system. With the knowledge of clinical neuropsychology, a proper and correct assessment, diagnosis, treatment, and or rehabilitation techniques to patients with neurological, medical, neurodevelopmental, and psychiatric condition and other cognitive and learning disability can be performed. The primary measurement of neuropsychological assessment, tests or batteries, is using paper and pen based as well as digital bills to understand an individual's cognition compared to a normative group. Then what is cognitive neuropsychology? Cognitive neuropsychology is a branch of cognitive psychology to measure the cognitive function using neuroscience approach. The aims are to understand how the structure and function of the brain relates to specific psychological processes. From here, we can learn and understand more about the cognitive and functional architecture of perception, attention, learning, memory, processing of spoken and written language, thinking, reasoning from the normal or healthy human brain, and then distinguish the feature with the study of people with neurological and other cognitive and learning difficulties. In cognitive neuropsychology, neuroscience approach such as brain imaging are used to assess the cognitive function at the specific psychological process in healthy and diseased individuals. Valid and reliable neuropsychology assessment have been developed over the years to assess all areas of cognitive functioning, including intellectual function, for example, IQ tests, Intellectual function refers to general mental capacity and cognitive abilities such as learning, reasoning, problem solving, and so on. An IQ test is one way to evaluate intellectual functioning of the system. Wechsler Adult Intelligence Scale, Wechsler Intelligence Scale for Children, and Wechsler Preschool and Primary Scale of Intelligence are other instruments that can be used as indicators for intellectual and cognitive purposes. There are very few tests also to assess intellectual and cognitive function. Memory has several types such as long-term memory, short-term memory, and working memory. Each type has a different test that can be used to assess the nature and severity of memory dysfunction and even to monitor changes in memory function over time. Here is the example of memory instruments such as the Ray Auditory Verbal Learning Test, Wechsler Memory Scale, and so on. Some of these tests has been developed in many other languages. Next is speech and language. This component is very important in terms of our ability to communicate. This component evaluates the ability of speech, reading, and writing. Multiple aspects of speech and language are examined, including articulation, which is articulation is the ability to pronounce words accurately, expressive language, the ability to communicate our thoughts to others in coherent way. It requires people to have proper knowledge of grammar, though this knowledge may be implicit, and a vocabulary that is sufficiently diverse to convey content. Receptive language. This component refers to our ability to understand language, inclusive of the ability to follow direction and answer questions that have been asked. Phonological processing. This component refers to analyze and manipulate sound structures of words. Next component is written language, which refers to reading and writing. Here is the example of speech and language instruments such as a Boston Diagnostic Aphasia Examination and Boston Learning Test. Visual perception is one of the components refers to evaluate the ability to interpret the information that our eyes receive. There are a few examples of a screening instrument to assess visual perception, namely occupational therapy adult perceptual screening test and Leuven perceptual organization screening tests. Other cognitive function that can be assessed is psychomotor or psychosensory function. This component refers to the ability of wide range of action involving physical movements and sensory related to conscious cognitive processing. This ability can be measured by accuracy or speed. The example of instruments related to psychomotor or psychosensory functions are right-word test, right-left discrimination, finger localization or recognition, dichotic listening, and line cancellation tests. To provide the knowledge of behavioral and cognitive psychology, integrating neuropsychological assessment and brain imaging is suggested. From here, scientific studies that aim to develop a mechanistic understanding of brain dysfunction can be performed. Here are the examples for the combinations of keywords that I use, which are psychology or neuropsychology and neuroimaging. to search number of publication or studies in PubMed database until August 2020 to see the publication pattern in integrating neuropsychology or psychology and neuroimaging. Although we are in a pandemic situation, trend of integrating neuroimaging and neuropsychology studies keep or still increasing and shows its contribution to knowledge, clinical and community. For a study example in integrating neuroimaging and neuropsychology, it will be discussed in the tutorial. As for conclusion, so from this module, now you can describe type of brain imaging modalities that measure or assess the structure and functions of the human brain. Furthermore, by using neuropsychological assessment, the brain-behavior relationship can be explored. Additionally, neuroscience approach can be used to understand the cognitive and functional architecture of the human brain. Interestingly, integrating neuropsychological assessment and brain imaging can further understand behavioral and cognitive psychology in the normal and diseased brain. So that's all. Thank you very much.